The patron of our the talk show is we always give chance to our guest to introduce himself in case something we missed, so he can give a brief introduction by himself. So please let introduce yourself to my audience.
Thank you so much, Sir Ijaz. It's a really great pleasure for me that you've invited me in this session. And I would like to, first of all, thank you so much that being my mentor um, and the, the person who provided us the platform, Mr. Ijaz Hidayat, sir, I would like to first thank you so much for the whole journey that we have spent together. Um, not not lively, but through the internet medium and social media medium, because you used to come frequently. You are amongst the frequent flyers also.
Yeah, yeah,
So
yeah, yeah,
thank you so much. I have been working in Dow University of Health Sciences. Actually, I established the department
yeah,
just
yeah.
because Sir Ijaz Dayat allowed me to do so. He provided us the platform uh, through which we proved ourselves. He knew that every jam the कि कौन सा बंदा कहाँ पे fit होगा. So that's why he offered me the position of academics in academics in Dow University, and then through his efforts and by the grace of Allah, I was appointed as an instructor at Dow University at my alma mater, my mother institution, and then I have to prove myself. That's why I've did a hard work. I completed my training in Aachen because at the time I was appointed, I was still on training in Aachen University. Then,
Hatim, I'm interrupting to you here. I still remember the time you were the student of the perfusion in Aga Khan University Hospital, and you have a spark of education. So this is the reason we chosen you to be a educator. And the time when we decided that you are the right person in the future going to be a educationist, and you prove this one. This is the reason, and Alhamdulillah, you proved yourself. And now today
thank
you
you
are
so
the
much,
assistant professor in Institute of Medical Technology in Dow University of Health Sciences. So carry on now.
sir. I didn't only prove myself at that time. Still, we are working on the same. I'm trying to uh, prove myself again and again. I became the first assistant professor at Dow University, not but all around Pakistan. The first assistant
Yes,
professor in perfusion sciences,
yes, yes, true.
and the first this news was first disclosed to you by me. I disclosed.
Exactly, exactly. I'm the first person
Yes,
to
sir.
whom you
You are the
call,
first
and
person.
you just inform that you become the first assistant professor in perfusion section, and it was a milestone for perfusion community that now perfusionists are starting to work in the field of education and becoming the. Very soon you will be a professor, inshallah. This is
Inshallah. And sir, I would like to also update that we are going to be the first uh, department or university in Pakistan who is going to establish a wet lab, a fully furnished, fully functional wet lab in Pakistan in Dow University of Health Science, inshallah.
Thank you so
And
much,
we are
Hatim.
working on the same.
Thank you so much, Hatim. This is the great point you just raised up. So wet lab. So would you like to elaborate about the wet lab? What will going to be get the benefits to the students with the wet lab, which the Dow University is going to be going to start the wet lab soon. So what were the benefits to the, especially the
Yes, of course.
students?
From 11 years of experience in teaching, I came to know that many students around Pakistan and around in Karachi are facing the difficulties in getting trained and getting hands-on experiences before they go on live bypass surgeries or on live ECMO operations. They need to be well aware, because the surgeons and the physicians want someone who is very much professional person, because that's a very challenging job to become an professional ECMO specialist or a perfusionist. So we have found that many students are facing this difficulty, that they didn't had enough experience on these on the issues on CPB. So the wet lab will provide hands-on experience prior to take any chance on patient.
Yeah,
So
you
they
are
will
right.
be
Actually, I will humbly request all the universities all over the world, most of the university having the wet lab, but the university where they don't have the wet lab, they need to start, especially in Pakistan. They need to have a, in all university, they need to have a wet lab, especially the field of perfusion, where you can't go directly to the patient and it is very risky. So better to start your professional career during your educational period on the wet lab, so you become a more skillful the time you're going to operate the surgery, you're going to involve in a cardiac surgery, so you will be a more successful and 100% accurate person to run a bypass. I agreed with you.
so as we are producing so much of a human resource. Pakistan is one of the countries producing so many perfusionists, and ECMO perfusionists are going to be appointed around the world, such like Kuwait has appointed so many people. So they should be well experienced. They should not be saying that because there is no ECMO in Pakistan, so we are not trained on ECMO. They should be they should get enough hands-on experience on mannequins and simulators. So
Yes,
these
that
are
is.
actually the simulators which are being used in cardiac, which provide the environment of the cardiac surgery and the ECMO environment, so that the patient is there, and the cannulas are attached, and the patient is on bypass, and there are different scenarios which are being pre-installed in that machine, which gives the perfusionist the ability to troubleshoot those occurrences on bypass, so that they can be well experienced with those events that can occur unusually on bypass, or usually, because there are routine procedures and there are unusual occurrences on bypass, such like air embolus,
Very
massive
right.
air embolism, or there is a runaway pump head, or there are
Yes.
so many
So
problems
many,
which
so
are
many.
being
So many.
reported around the world.
It's true.
So these wet labs are going to train professionals before they actually have the same issues on bypass, so that they are well aware of how to deal with them.
So, Hatim, what is your message for the newcomers, or you can say the presently the students of the perfusionists in the world, in Pakistan and the world? So, what is your message for them, like for the safety
my
of the
my
patient
my
safety?
biggest message which I would like to share is that there is no shortcut, and don't seek for a shortcut, because every field like perfusion needs a lot of experience, so that a person becomes uh, well aware, just like a diamond. As to become a precious stone, the diamond has to go through a lot of a lot of इसको बहुत ज्यादा तराशा जाता है, तब जाके it becomes a precious stone. So
Yeah, just like
uh,
जैसे हीरा पत्थर में घिसता पत्थर
बिल्कुल सर,
सीना पत्थर पे घिसती है तो रंग लाती है, हीरे समंदर के जुल्मतों में पलते हैं तो जब जाके जर्रा शहवार बनते हैं, तो एग्जैक्ट यू नीड टू
जबरदस्त जबरदस्त सर, आप जो मुकम्मल करते हैं ना किसी शेर को दाल के बीच में, बात ऐसी मुकम्मल करते हैं कि बस फिर याद रह जाती है।
नहीं, वो
सर,
थोड़ा सा आपने एक सीक्वेंस बनाया, सो आई जस्ट वांट टू
बिल्कुल,
ऐड
ये जो
कि
सुकून है आपका ना, जो शायरी का, ये
दिस
जान डाल देता है किसी की बात में।
Thank you so much. Thank you so much. So, Hatim, we'll come back to the point. This is not the poetry session, so we'll continue with the actual
No,
point.
no, because
So we'll sit.
I've been reading your shairis so much these days.
Thank you
That's
so
why
much. Thank you so much.
I'm well aware of that.
So,
So
Hatim, I
yeah,
have one concern, one point. As you know, the we have the perfusionist is coming in the market, and you as you highlighted about the wet lab. What are you thinking or seeking for perfusionist to be a more like in a safety methods. Example, which are the measurements we required in universities to, like, one point is the wet lab. What is the rest of the points we need to make a more safety measurements? We increase the more safety measurement during their educations, so they become real perfusion scientists or say specialists. So what are the, like, you in your education you just go through with the theories part. Yeah, of course you're going to add the now the wet lab. How about the clinical side? What you are thinking? Do we need to increase more the clinical part in the academical period, or it is in a which is going through now?
As far as I think, 40% of the program should be academic or theoretical, other, and 60% should be practical, because this is a practical field, and the person, as much he needs theoretical aspect, it also requires a lot of practical aspect. But as in Pakistan, in Karachi, there are very few centers who are providing full time cardiac surgery. You know, full time cardiac surgeries are being performed very less in Karachi.
Mhm.
So centers around Karachi in Pakistan should focus that more and more new students and trainees should be appointed, and they should be trained so that uh, with their theory they can be more equipped with the practical experiences. And the perfusionists around Pakistan should also be taken as mentors and as visiting faculties in different universities, so that they can share the real time experience on patient, because the academic person cannot share the real time experience, but the clinical perfusionist can share the real time experience with the students, that these are the problems and this is are the solutions, because the book says something else and the practical experience is something else. That was what I think. So there should be a synchronized communication and coordination between the universities and the hospitals, and it should be run simultaneously.
True, very true, very true. So, Hatim Heathers, as you are the inspiration of most of the students and even the perfusionists, upcoming perfusionists,
Thank you so much, sir. I don't think so.
you no,
You are my inspiration, and I
no,
think you
no,
are
no,
the
no, sure.
inspiration for most of the people working in Pakistan and around the world too, because you have proved your worth, and we knew that you will do something very high.
Of course, no, but as presently you are the inspiration of our young youth. You become the first assistant professor in perfusion section in the University of Health Sciences. What are the measurements the upcoming the perfusion need to take to become like assistant professor or professor, or what are the way to go through all this stage to become a professor in perfusion? So you can guide to the juniors so they can go through some the people who want to do the clinical side, not a clinical educational side. So what are the way they need to take to become a like assistant professor or professor in the field?
While if you want to come in academics, there is a step-by-step approach. Of course, you can't become an assistant professor directly. For that, you need to first go through the rigorous training program, such as BS in Perfusion Sciences, then through a master's program. Either you can choose any master's program, that is master's in public health or master's or MPhil in physiology or something, because physiology is the most prominent subject for a perfusionist to
Perfusionist,
learn.
yes, yes.
And if you do an MPhil in physiology, then you can be hired as an assistant professor if you have a couple of research papers also. So my recommendations, if you want to come in academics, you should be very focused, and you should you should decide yourself that, okay, I am more into academics and not clinical practice, because this is a clinical and practical field, perfusion sciences. So if you opt for academics, you need to be very much into academics.
Yeah.
Education is the most important thing for that now. So after doing master's MPhil, you will automatically become a assistant professor if you have two research papers in any field or like in cardiac perfusion sciences.
Hatim, really enjoy your the talk. I want to continue, but you know the pattern of our program is we limited the time. And what is the take-home message for my viewers, please?
Uh, the take home message I would like to give to all the viewers and listeners is that uh, avoid leg pulling and humiliation and bullying in the field. Um, you should be welcoming and should welcome the new trainees and new people, because through them this field can flourish. And I personally want this field to go to sky high. So I would like to share that whenever you approach to any position in life, you always welcome the newcomers.
Yes, very right. Thank you so much. Hatim, I love to talk with you more, but we will come back with a new talk, with new sessions. And today is typical, the talk, the session of my today was just to have highlighting your personality and your profession, and it's a
Thank you
marvelous,
so much.
the great time. See you next in other sessions. Have a nice,
Thank you,
good
sir.
day. Take care. Khuda Hafiz.
Allah.
Allah Hafiz.